All right, students, for this Dewey-ing history debate, we're going to be talking about pandemic-related policies. Unfortunately, you have had a lot of experience with pandemic-related issues, but we're going to try and put some of those into historic context. Although you've heard pandemic, I'm sure, thousands of times in the last 6 months, we need to get a definition of it. Pandemic is an occurrence in which a disease spreads very quickly and affects a large number of people over a wide area or throughout the world. Put that into your own words. How could you describe a pandemic? Our question-focused document is going to be this cartoon published by the Topeka Health Service called Get the Anti-Flu Habit. How might what you see in this cartoon be similar to a problem that's happening today? Shouldn't be too hard for you on this one. Now you need to generate a question after you have made the connection. Oops. All right. For our contemporary research, we're going to talk about this email that USD 501 sent families last week. Remember, we're trying to find out what the problem is, what may happen as a solution, why people support and oppose it. The 501 sent an email saying, "Dear Topeka Public Schools families and staff, we need our community to help us in also following the health department's guidelines as we work together to keep schools open for our scholars. The health and safety of our students and staff is our top priority. The Shawnee County Health Department informed us that due to some community members across the county not following guidelines for wearing masks and social distancing, the spread of the virus has increased significantly and is expected to impact schools soon. It is our hope that we can continue to offer in-person school all year. We feel it is important to have plans in place in the event cases reach uncontrollable levels and impact our schools." So in our first paragraph, what did we find out is the policy problem? What is happening? Next paragraph. To avoid having to return to full remote learning for all students, we need help from everyone in our community. We need everyone to consistently follow the health department's guidelines in wearing masks and in social distancing. What is the solution we might have to resort to if things don't improve? Thank you for your continued support of your children and the district. So we didn't get specific answers to either of these written out in the text like some articles we study, but you need to tell me, why do you think some people support us returning to remote learning? And tell me why you think some people oppose us returning to remote learning. After you've done that, tell me what your opinion is. We're now going to start our case study, our compelling policy question. What outcomes should policymakers consider when making pandemic disease policies, the consequences of restricting or of not restricting citizens' daily lives? Go to our webpage, and we're going to talk about City Health Officer Dr. Clark's official notice. This is a newspaper clipping of the official notice. Because of the experience of cases of epidemic influenza, also known as Spanish influenza in Topeka, all public and private schools, Sunday schools, and churches are hereby ordered closed, and all public gatherings, dances, shows, and entertainments are hereby prohibited until further notice, in order that the spread of the disease may be limited and the health and lives of citizens of Topeka may be better protected from an epidemic which now seriously threatens. All citizens, firms, and corporations are requested to assist in combating this disease by cooperating in the enforcement of this order. This order shall apply to all gatherings, of more than 20 persons, except such as may be considered a military necessity, and shall not apply to Liberty Loan Committee meetings or to gatherings of Red Cross workers for the purpose of preparing material for use by the Army or in combating epidemics. This order shall be effective after 12 o'clock noon on Wednesday, October 9th, and shall continue until further notice. So there was quite a few specific things in this order, but just give me the basic summary. This order would do what? We now need to study the historic context, figure out what was going on that would have led to Topeka debating closing down schools, closing down entertainment, generally closing down everything. With the start of World War I in 1914, the mobilization of soldiers all around the world began, including the United States in 1917. The mobilization of soldiers and the movement of large numbers of troops made it easy for a viral disease to spread rapidly. Historians and virologists disagree on the origin of the Spanish influenza, with some arguing it began in China and others arguing it began in Kansas at Fort Riley. Despite the debate over where the virus began, the deadly virus began to rapidly spread around the world. In the spring of 1918, there was the first wave of the Spanish influenza, which did not prove to be too deadly. But during a second wave in the fall of 1918, people were dying within hours of showing symptoms. As the pandemic swept across America, many states and cities began passing measures to stop the spread of the disease. So, what do we need to understand for what was going on at the time? Pretty clearly, there was a pandemic that was spreading around the world, and that included spreading around the United States. So, if Topeka was debating closing down, what must we know? What had reached Topeka? What was happening in Topeka? Section 1 of our case study, guiding question, why do some people believe the government should create restrictions for a citizen's daily life in response to pandemic diseases? We're going to read a note from the Secretary of Kansas Board of Health, Dr. S.J. Crumbine, in a 1918 statement on the Spanish influenza closing order. Dr. Crumbine said, "The epidemic is here. We cannot get away from it. So the thing to do is to take the most effective methods of slowing it down. The history of the disease shows that its virulence depends to a considerable extent upon the rapidity of transmission. If we can keep folks away from crowds, have them take precautions against the disease, we can extend the period of transmission so that the disease loses its virulence and becomes only a light cold, and many are not infected who might take the disease. A general closing order is the most effective method of slowing down the disease." Why does Dr. Crumbine think we should restrict citizens' daily life? What's his most important points here? After you've written that, tell me why that idea from 1918 still matters today in our debates over shutting down schools. Our second piece of evidence is a set of cartoons from the North Carolina State Board of Health. The way the Germans did it at Chateau Thierry and the way North Carolinians did it at home. Our first cartoon here is the way the Germans did it at Chateau Thierry. During the recent war, approximately 1,000 men from North Carolina were killed in a battle. You have a German soldier here shooting these American soldiers. In the second image, the way North Carolinians do it at home. During the epidemic last fall and winter, 13,644 North Carolinians laid down their lives in a spit-borne disease, influenza. What are the creators of this cartoon trying to show us? How is it some North Carolinians had died during the war, and then this was happening back home? What's the fear of this disease? A spit-borne disease. After you told me what the main idea is, tell me why that still matters for today's debate over the pandemic. If back in 1918 they were concerned about what was causing people to perish, why does that matter in 2020? Section number 2, a guiding question: why do some people believe the government should not restrict a citizen's daily life in response to pandemic diseases? Our quote is from a meeting the American Public Health Association in 1918. New York Health Commissioner Dr. Royal S. Copeland said, "The most important part of disease control is the public school system. We have 1 million school children in New York, and 700,000 of them come from tenement homes, the poorest homes on earth. It will be better for these children to go to school where the schoolhouses are sanitary and are under the strict regulation than to permit them to linger in the schoolyards or in the basements, etc. It was better for these children to be attending school than to be at home under unpleasant and unhygienic surroundings. If any child showed symptoms or signs which indicated the possibility of influenza, that child was put in a room by himself until examined by a nurse or by a doctor to discover whether he or she had influenza, and a board of health doctor or nurse would find out whether the family had a family physician, and if so, whether there was a possibility of isolating and protecting other members of the family. If not, the child was to be placed in a hospital where it could be given care. It is a great deal better to care for children in this way than to turn them loose on the streets to play where they will." Why did the Commissioner Royal S. Copeland think the best thing to do was to have schools open? To him, what service did the schools provide? Think about what his main ideas are as to why we need children going to schools. Now consider why that would matter for today's debate over closing down schools. If he was focused on the healthcare aspect of the schools, how might that be related to schools today? What are we concerned about returning to remote learning for? Is it denying students access to possible healthcare? Or is there something else that we should consider? Let's talk about this cartoon for our second piece of evidence. The Philadelphia Inquirer ran a cartoon made by Jim Nasium titled "An Unwelcome Visitor." What do we have happening in this cartoon? We have a sporting fan hanging on the sporting world, and what has arrived on the sporting world? The Spanish flu germ. What has the Spanish flu done? Read the sign. Fight clubs closed, theaters, saloons shut up, football and basketball called off. The sporting fan says, "Hey, get out of here. For the love of Mike, ain't things bad enough without you?" What is the Spanish flu ruining for the sports fan. What's the main idea here? And if 1918 people were worried about sports getting canceled because of closed down orders, how might that be related to today's debate over closing down schools? If we close down schools, what else might get canceled? And how might people feel about that? All right, step 2C. What did past policymakers decide to do? Put yourself in their shoes. There is a deadly virus spreading through the community, killing many, many people. Do you think the wisest thing to do would be to shut things down, restrict citizens' lives in order to protect them from the virus and stop the spread? Or do you think it's not the government's place to do so, to take control over their lives in some ways? The state of Kansas and many other states around the United States required schools, restaurants, theaters, etc. to close in order to slow the spread of the Spanish influenza. These decisions were all made by state and local officials. The federal government did not require the quarantining of people, even though legally had the power to do so. The federal government did pass House Joint Resolution 33, which authorized the spending of $1 million to help fight the spread of the disease. A study done by a group of medical researchers on 43 different U.S. cities' policies during the Spanish influenza pandemic titled Non-Pharmaceutical Interventions Implemented by U.S. Cities during the 1918-1919 epidemic influenza pandemic found that the cities that implemented non-pharmaceutical interventions earlier had greater delays in reaching peak mortality, lower peak mortality rates, and lower total mortality. Terminology here: non-pharmaceutical. Pharmaceutical meaning a drug or medicine. So non-pharmaceutical interventions would be ways that we address the disease without medicine, doing things such as shutting down. So the research found that non-pharmaceutical interventions such as social distancing, school closures, and shutting down the public places saved lives. The researchers generated this suggestion: in planning for future severe influenza pandemics, non-pharmaceutical interventions should be considered for inclusion as a companion measures to developing effective vaccines and medications for prophylaxis and treatment. Some researchers believe as many as 50 million people across the world were killed by the Spanish flu pandemic, including an estimated 675,000 Americans. Here's a chart showing the peaks of the pandemic and mortality in different cities across the world. So clearly, some policymakers decided to shut things down. And why was it they chose to do that? What was the consequence of catching the Spanish influenza? What were the consequences of that policy decision? What did the researchers find? That cities that implemented those interventions, what changed or what lessened? Let's compare and contrast the two debates. Similarity, we're talking about pandemics, right? What was the pandemic in the past? What is the pandemic today? Just tell me the names of them. All right, you have two choices for your policy advice. You can either create the form as usual, although this time you're not writing to your state or national policymaker, you're writing to Superintendent Anderson. You can either write that form, or you can use documents from our case study to create a meme. The idea of this would be that it would be something you could actually share on social media. Members of the community need to see this. Hopefully you're realizing that the spread of COVID in our community is directly tied to whether or not you get to go to in-person learning. So if you want to stay in school, we all need to take action to try and improve things and reduce the spread of the disease. If you are going to create a meme, you need to make sure you're using either an image from the case study, one of the cartoons, and modifying that to work for today's pandemic, or you're taking an image that's modern and using a quote from the past case study to be able to help explain the importance of your idea. If you are going to use the meme, paste it here, otherwise complete the bottom. Please let me know if you have any questions.